Great. Well, I just want to correct a few things that I heard this morning or this afternoon. First, PCORI is not a federal agency. We are an independent nonprofit organization, and though I'm sitting on this panel with other federal agencies, we do get 100% of our money from the PCORI Trust Fund, which is federal dollars, but we are much different than other federal agencies, and we're not subject to a continuing resolution, luckily enough. And I thought, I don't know, how many in the room have a PCORI contract? Not very many. So I thought I would spend a little bit of time talking about PCORI, our mission, what makes us a little bit different than some of the other organizations where you might be thinking about getting your funding from, and then provide a little bit of an overview of our telehealth portfolio, and then dive in on one project, maybe a couple, depending upon how much time that I have. So PCORI is focused on funding research that answers practical questions that are of interest to patients and their caregivers. So it's very focused on the point of informed decision-making. Another thing that we are really aiming to do is influence research, so it's no longer really focused on investigator, research-driven questions, but it's driven by the stakeholder and the interests that they want to see addressed and answered. So we're also seeing some shift in some of the other agencies in terms of better engagement of stakeholders in trying to understand what research questions are the most important to answer. Our mandate says that we should fund comparative clinical effectiveness research, and this means a lot of different things to different people. These are some of the main components of what we think about in comparative clinical effectiveness research. I think a couple points that I wanted to make is that the research should compare two or more options, and these are options that are already available and have some evidence behind them, or are in widespread use. So we do not fund developmental research. This is really, there has to be at least some preliminary data. The other thing that's important to point out here is that a large proportion of the studies that we fund are randomized controlled trials. And in fact, in the telehealth portfolio, 97% of the studies that we funded have been randomized controlled trials. So our authorizing legislation also mentions patient-centered outcomes research. Of course, that's in our name. And what is different about PCORI than comparative clinical effectiveness research? Whoops, let me just get back here. So really, it's this focus on patients and the focus on, there's a couple of aspects of patient-centered outcomes research that we think about. One is looking at patient-centeredness, and that is, again, to look specifically at what are the questions that patients want answered, and the other is what are the outcomes that are important to patients and other stakeholders. Another aspect of our research is focused on the patient and stakeholder engagement. And what we mean by this is really engaging patients and other stakeholders from the conceptualization of the research questions into the actual application and the proposal stage throughout the whole project as partners, not as research subjects. Specifically, we are looking at changing the dynamic between researchers and patients, so they really are an essential part of the research team. Interestingly enough, too, our merit review panels have patients on the panel, and we also have other stakeholders like health systems administrators, too. PCORI is organized around 5 major priorities that we indicated early on in the formation of PCORI. These are the colored bubbles over here on the left. There's the more traditional comparison between drugs and devices, which we call our comparative clinical effectiveness research group. There's the once we know what works in practice, how do we improve the care delivery systems in order to ensure that that gets put into place, and that's our Improving Healthcare Systems group. And then we have a big focus on addressing disparities and also in how to improve the communication of evidence-based science into practice. At the foundation here, we have also a focus on improving methods. Just to let you know, we have telehealth research that's been funded in all of these different areas here. And of course, ultimately, our goal is to improve patient-centered outcomes. Oops, I just went backwards. That's what I did. So we are the newcomers on the blocks. We've been here only for 6 years, but in those 6 years, we've actually funded quite a bit. We have funded over 570 comparative clinical effectiveness research studies, and we have invested over $1.6 billion. We have 3 major funding streams that you can apply to. One is our traditional investigator-led research, which we call our BROAD program, and this is organized around all those national priorities that I mentioned before. Those are usually our smaller studies, about $2 to $5 million and up to 3 to 5 years duration. About 2014, we decided to put together a program focusing on pragmatic clinical studies, and this is really getting at some of the things that Liz was talking about. We're really looking at larger studies of potentially national importance, focusing on those major research gaps that have been identified as by our stakeholders as important areas to focus on. They are typically multi-institution. They're pragmatic, large pragmatic studies, and the idea is potentially there is not going to be a lot of barriers to the uptake of the findings, and that they are scalable and easily implementable. There is a list of priorities that's on our website, and you can see which ones are there. Just for your information, we have had one in the last several cycles looking at teledelivery and mental health that's been up there. We also have our targeted funding announcements, and this is when we identify a topic of major importance that we feel that we can actually have a very focused amount of money to fund. As one example is palliative care. We just recently released an announcement in that area, and we dedicated $48 million to address one of 2 research questions in that funding announcement. And we've already been reviewing the applications. Several of the applications did use telehealth as a part of the component in palliative care. And also we had one in opioids, and one of the awards that we made there was a pharmacist-led intervention looking at people on chronic long-term opioid use and trying to manage that care and step-down care to potentially wean them off of opioids, but was supported by telehealth too.
I'm sorry, can I ask a question? Is that a one-time proposal, or are you going to offer palliative care?
So for the most part, these are one-time proposals. The opioids one that I just mentioned, that one was reissued. We also reissued one in back pain just recently. So we do like to fund kind of clusters of research around a common topic. Palliative care, it was just amazing the amount of interest that we got there. We have just a huge number of potentially high-impact studies in that particular area right now. So I don't know if we're going to reissue that specific one. I also thought that you should know about what we call PCORNet. And PCORNet is a large digital infrastructure branching multiple organizations into a learning healthcare system that allows for large-scale research to be conducted more efficiently. And this is a platform that potentially you can take advantage of. We have many of our studies that have come in through our large pragmatic studies, and also through our targeted funding studies have made use of this particular resource. It is really a network of networks. So there are over 33 organizations that are the principal organizations that are involved in this, including it's health system based, but also our patient-powered research networks. And many of these are affiliated with a lot more other organizations. Another thing that you might find interesting too is that mobile health is actually an important aspect of some of these networks in being used to identify patients for studies, being used to help recruit patients, being used to collect patient-reported outcomes, and also being used to monitor patients for some of these studies. So just very briefly about our telehealth portfolio, we have funded over 58 projects to be specific, and invested over $150 million in the area of telehealth. Over half of the studies that we've funded look at mobile health. And a much smaller proportion look at telemedicine, more traditional telemedicine. Back to the 5 priority areas that I was talking about, most of the studies that we've funded have come in through our investigator-initiated award. That's over 90% of those studies. But we do have a couple of studies that we expect to be really high impact that we have funded in our pragmatic clinical studies program, as well as in our targeted initiatives. One example for the pragmatic clinical studies is the one that's looking at telemental health in federally qualified health centers, and it's going to be enrolling 800 patients across 30 federally qualified health centers, so it's a very large study. Then we also, the one in the targeted, we have telehealth intervention that's addressing telerehabilitation among patients with multiple sclerosis, and that's going to enroll 1,000 patients. So these are much larger studies than the typical 100-patient studies. Just real briefly, this is probably not too interesting to you guys, but just to let you know, telehealth has typically been in the old history was really linking patients to specialists. Very little of our portfolio is focusing on remote monitoring or improving access to specialty care. The bulk of our portfolio is really looking at more patient-centered promotion of self-management and also education to patients and their caregivers about their disease. A lot of our portfolio is focused on vulnerable populations. So over 70% of our studies focus on racial and ethnic minorities. And also a high proportion, 40%, focus on low-income population. This is a pretty busy slide, but I just wanted you to know that our telehealth portfolio spans a lot of different disease areas, from rare disease all the way up, trauma and injury. Most of our funding is through the nutritional and metabolic disorders, specifically focusing on diabetes and obesity, and then also in cardiovascular health on stroke and on congestive heart failure. The ATA is working with Academy Health to identify outcome targets for telehealth, and this just arrays our portfolio along those outcome targets. You'll note that a very small proportion of our studies focus on cost savings, and this is clearly an issue of interest to researchers and policymakers. And this is partly because our mandate prohibits us from focusing on cost effectiveness, so we can't study that. You may be aware that the Agency for Healthcare Research and Quality just recently funded what they call an evidence map, which was mapping all the evidence. They looked at, I think, 58 systematic reviews and covered like 1,400 research articles. And while there's a really broad, I would say, evidence base in telehealth. They identified some particular gaps in research, and I just wanted to point out that these are the gaps that they identified here. Triage for urgent and primary care applications in pediatrics, that we have funded some research in these particular areas and are looking forward to see the results of these. Also wanted you to know that since we're fairly early on, most of our studies are in the process. We don't have a lot of results for many of our studies yet. So I just wanted to give you a little bit of a flavor of how our research is different and the kind of research that we fund by giving you an example of one particular study that we focused. This is looking at teledermatology, and it's a study being led by April Armstrong, who is out of USC. It has groups from Colorado, from Northern California, and from Southern California. They're enrolling 300 patients with psoriasis in a collaborative coordinated care network program that focuses on delivery of specialist dermatology care through the primary care center and also directly to the patient's home. So there's a triad that's being formed. And this is being compared to usual care, looking specifically at outcomes related to severity of disease as well as quality of life and access to care in rural areas. So the study looks at rural areas, but also is focused on a disadvantaged urban population in LA. I think an important thing to point out about the study, which is really very much the flavor of the kinds of studies that we fund, is that the stakeholders were very involved in the development of the intervention before it came to us. And that she is working very closely with a lot of stakeholder groups, including the National Psoriasis Foundation, the American Academy of Dermatology and their telemedicine task force, the American Telemedicine Association, and also working very closely with the California Association of Rural Health Clinics, the California Primary Care Association, and the State Network of Colorado Ambulatory Practices. And all of these groups potentially could magnify the impact of this project once it gets done. This is an area, I think, of important policy relevance because a lot of Medicaid programs don't currently cover store and forward technology, which is being studied in here. And I think that this is, again, hopefully an indication of some of the impact of some of our work. I'm not going to get into this last study here. This is a study on virtual health clinics in the area of Parkinson's disease. It's actually just completed, but if people would like to know more about this, I can talk a little bit more about this. And just in conclusion, we have a very large and diverse portfolio in telehealth. And we have the potential to fill some very important evidence gaps. We are, despite the fact that we have a very robust portfolio, we are still looking for additional research in this area, particularly if it does address a major research gap. And that's one thing that we are interested in looking at. You're supporting the evidence behind why that's an important study that needs to be done. It's plausible that patient-centered focus that is the flavor of our research might help with the adoption and sustaining long-term use of telehealth. That's yet to be seen. And again, we're just starting to see some of the early indications of our projects. Thank you very much.